Bismillahirrahmanirrahim. Assalamu Allaikum friends. Welcome to our YouTube channel, The Vigour Hub. As we discussed in the last video about dengue fever, we talked what is dengue fever, how does it spread, which kinds of mosquitoes responsible for spreading this disease, what are the symptoms. Today we will continue, we will talk about the treatment options, about the precautionary measures, and about the phases of this dengue fever. There are three phases of the dengue fever. The one is febrile phase, the second one is critical phase, and the third one is recovery phase. Febrile phase, there is sudden onset fever. It can be more than 38.5 degrees centigrade. The patient may complain severe headache, body ache, muscles pain, joints pain, etc. There can be generalized body weakness, vomiting, nausea. There can be some non-specific symptoms also, like abdominal pain and skin rashes. There is chance of retroorbital pain also. Might some patients are complaining around the eyes pain, and there can be maculopapular rashes, and it observed only in a few patients. Critical phase. Most of the patients recover from the febrile phase. There is a census that more than 80% patients recover from the febrile phase. Only a few patients enter to the critical phase, those who are having secondary infection. There are four types of dengue viruses: dengue 1, dengue 2, dengue 3, and dengue 4. If the patient is having any secondary infection, there are high chances that the patient may enter to the critical phase. The most important feature of this dengue fever is called thrombocytopenia, means low platelets count. If the patient is having low platelets, there are high chances of bleeding. The patient may bleed from the nose, that's called epistaxis, menorrhagia, etc. That's called dengue hemorrhagic fever. There can be leukopenia, low WBCs count. And if the liver is involved, there may be the patient is having elevated AST, ALT, that's called transaminitis. There can be, the patient may complain of low BP. That's because of the vascular permeability and capillary permeability may increase, resulting low BP. That's called dengue shock syndrome. After febrile phase and critical phase, now there is recovery phase. In the recovery phase, the patient will feel better, the vital signs will be stabilizing, the vascular permeability and capillary permeability will heal back, it will come back to the normal. And only a few patients can get pruritic rashes also. The patients may still complain of fatigue, generalized body weakness. It will take from weeks to months, depends upon the severity of the infection. Now we will talk about the diagnosis. There is a specific test called antigen dengue IgM. It can be performed on the day 4 to day 5 of the infection, and the DNA can be detected in the saliva, serum, tissue, etc. What are the treatment options? There is no specific treatment for the dengue fever. Only the symptomatic treatment can be given. If the patient is complaining of headache, fever, the patient can take paracetamol tablet, can take a lot of fluids, and most of the physicians avoid NSAIDs group. Because there is a risk of bleeding because the action of the NSAIDs, anticoagulation, and it can increase the risk of bleeding. How we can prevent ourselves, we will talk about that, how to prevent this disease. The most important is if we are planning to go a tropical area or subtropical area, so there are vaccines available, we can take the vaccines. There are available mosquito repellent lotions, we can apply that one. And there are some sprays available, we can spray inside the home and around the home. And we should wear the full sleeves to avoid mosquito bite. That's all for today. If you like our videos, you can subscribe and you can get the notification for our new videos. Till that time, see you in the next video. Take care, stay safe. Allah Hafiz.